right.
Abebe, why don't you, we've known each other for quite a while, but why don't you, I'm going to start with just asking, why don't you tell us your name, what your title is and where you work, and then how we know each other and how you know Lifebox.
Yes, thank you, Tom. My name is Abebe Bekele. I am an Ethiopian. I'm a general and a thoracic surgeon from Ethiopia. I am now based in Rwanda, Kigali. I am Dean and Deputy Vice Chancellor of Academic and Research Affairs at the University of Global Health Equity in Rwanda. Well, our relationship goes back to about 5 to 6 years back when we started the implementation of the Clean Cut project. Initially in Jimma, then we brought the project to Addis Ababa, to Minilik Hospital and Addis Ababa University. And this is how I knew Lifebox and started working closely with Lifebox. I served as the sort of a clinical lead for this project in Ethiopia until July of 2018. But my relationship with you goes back to our surgeon days, in fact, a few years before that.
Indeed, indeed. Well, thank you for taking the time to speak with us. And you said now that you're currently in Kigali. And yes. Can you tell me a little bit about what's the current situation for COVID in Kigali and then in Rwanda more generally? And then I'll also ask you about that in Ethiopia and what your understanding is. But let me start with Kigali specifically, and then Rwanda more generally. What's the situation?
Okay. COVID is reported from Rwanda 2 weeks ago. Last night, the report from the Ministry of Health is that there are about 70 cases, confirmed cases in Rwanda. The communication at midnight last night showed the cases rose to 75. The majority of these cases are travelers from either Dubai or other European, mainly from Dubai. There are a few horizontal transmissions from exposed people here in Rwanda, quite a handful of people. All the cases have been reported in Kigali. There are no cases reported so far from outside of the capital city. Since last Saturday, I think about 11 days ago, Rwanda has implemented serious social distancing. All schools, work is completely shut down. Kids are staying at home. All of us are working from home. All elective surgeries are cancelled. We are waiting for elective cases. And there is a serious implementation of social distancing here there's a serious leadership here in Rwanda. So social distancing is implemented very seriously. Since 4 days ago, the government has also started distributing food to the poor in the country. Obviously, in a continent like Africa, you don't expect people to stay at home and get paid. They have to earn their living. So at least they need to eat. That's what the government is doing at the moment. There is a very good COVID diagnostic and treatment system here led by the Rwandan Biomedical Center, which is under the Ministry of Health. A very strong contact tracing, very strong testing, and treatment facility so far. The system has not yet been overwhelmed. In Ethiopia, the information I had until last night was there are 25 confirmed cases. Again, the majority coming from abroad, from Dubai, from India, from Japan, from other countries, and very handful cases of horizontal transmission. Cases are reported mainly from Addis Ababa, the capital city. 3 cases from Adama, about 100 kilometers away from Addis, and 1 in Amhara region, about 760 kilometers away from Addis. Again, there is a good testing structure in Ethiopia. All the main regions have a PCR capacity, but as you know, PCR is technique intensive, logistics intensive, but there is testing capacity. Again, the country is not yet overwhelmed with cases. there is some preparation going on. Ethiopia has also implemented social distancing. All schools are out. People are advised to work from home. However, as compared to Rwanda, the implementation of social distancing has been a challenge. I can see that there is a serious challenge. People are still working together, walking to cafes, theaters. So the implementation of social distancing is not yet strong as in Rwanda.
And then, so it sounds actually like there is a plan for testing. Do you have a sense of whether there is either widespread testing or a plan for widespread testing in either Rwanda or in Ethiopia?
I'm very sure there is a plan, but as you know, these are poor countries. The entire Africa is resource constrained. You heard about the donation by the CEO of Alibaba, 20,000 test kits for most African countries. Countries are using that at the moment, and they were able to get some from WHO and from their own resources. But it can never be enough. Ethiopia has 110 million people, Rwanda has 11 million people, and even if they wanted to do wide scale testing, I think it's going to be a challenge. And PCR, Ethiopia, I think, has 7 or 8 centers that can do PCR. So even if we wanted to do wide scale screening, I don't think that's going to be possible.
So I'm going to pivot a little bit, and you're a surgeon. You're obviously dean, so you have a lot of administrative responsibilities. But I'm curious as to what the response has been like in the organization in the hospital in Rwanda. What things are you seeing? What kind of things are you doing as a clinician? And what things are the hospital doing to prepare for COVID?
Mm-hmm. Yes. As I said, the first case was reported 2 weeks ago. And the next day, we decided to force all our employees to work from home. We shut down the Kigali office completely, and everyone is now working from home. And we completely isolated the campus in Butaro. Our campus is located 2 hours drive away from Kigali. So we completely isolated it. We have 52 students in the campus. About 95% of our students are in the campus. And most of our staff and faculty are in the campus, but it's completely shut down. In fact, they are just finishing their 2 weeks of isolation tomorrow. I'm happy to see no student, no staff, no faculty has any symptoms or is tested positive. Classes are changed to online teaching. We did not miss even a single day of teaching. We are teaching through Zoom and other e-learning resources are there. The only thing that's missing is the laboratory experience and dissection experience to the medical students. But we are even doing oral exams, written exams online. Everything's transformed. We have set up support systems to our staff, psychosocial, mental, and other supports are already communicated to the staff, and we have active communication of staff and faculty and students. We have set up an emergency response team about 3 weeks ago, chaired by myself. 9 people are in it, including students, and we communicate with the team every day. Communication comes only from me to the entire staff, approved by the committee. And we have prohibited anyone from posting anything in the website, in our WhatsApp group, in the faculty group, to avoid confusions and wrong information spread. So any information approved by us is being transmitted. We have routine communication with our parents of our students, our donors, our staff and faculty. We're also extending our support to the government of Rwanda. We have epidemiologists and 1 health experts among us who are members of the National Committee. All of us are on standby. Anytime needed, we are ready to assist. And we have volunteer students, faculty, and alumni who are now working at the airport, who were working at the airport when screening passengers. As soon as Rwanda banned all travel, that was stopped. So we are in a fairly good position. No cases, no problems so far, and we have good, I hope, good leadership put in place to manage the crisis.
And then how about the hospitals? What are the hospitals doing to prepare?
Yes, about 5 minutes away from our campus is the Butaro District Hospital. That's our teaching hospital. And I also offer my services to the Central Hospital University here in Kigali. My colleagues there have completely stopped doing elective surgeries. They're only handling emergencies. Preparations are being made to be prepared for the massive influx of patients, maybe when the peak arrives. The peak is expected to be in about 10 to 14 days time from now, across Africa. It's not just Rwanda, but across Africa. Trainings are being given to professionals, specialists, doctors, nurses, and others. As you can imagine, I don't even know how to prepare for COVID. The amount of resources, human resources you have versus the expected patients, I can't even.
We lost you there a little bit, but so I wanted to follow up that because you're a surgeon. What things are surgeons in particular doing, and what concerns do surgeons have with respect to COVID preparation and possible even the need for treatment? What kind of concerns do you as a surgeon have?
A surgeon. 2 or 3 major concerns. Number one is, are we prepared to handle the crisis? COVID is a system-wide issue. It touches health system, defense, national security, food security, everything, electricity, water supply, everything. So are we enough? Are we prepared to handle this? This really worries me, and it's also a worry of most of my surgeons. When you come specifically to surgery, as I said, all electives are already cancelled. This means in a continent where the backlog is more than 6 months, we are adding to this serious backlog. Most of our cancer patients are not getting operated. So delay plus cancer is a close to death sentence. Most of our pediatric patients are almost cancelled. So we are worsening or an already existing access to surgery question. Number two, the resources we have. Everything is now diverted to being prepared to the pandemic. Surgical gloves, ventilators, anesthesia machines. The likelihood that operating theaters will convert it to ICU is there. So every resource we have now is now it should be used to tackle this problem. In a continent where resources are already scarce, you can imagine how serious the problem is going to be. And Italy, over the past 3 weeks, lost more than 50 professionals because of the disease. I mean, this is going to happen in Africa. We are going to lose professionals.
Yeah.
Add that up to the serious lack of personal protective equipment, testing kits, resources, and other protective gadgets. These are really expensive, in high demand all over the world. There is no country that spares a few ventilators or a few PPEs. So you're kind of alone because everybody has the same problem. And the third is, I'm glad to see the African CDC, the AU, and the African leaders are coming together to discuss some of the problems, but central leadership, I haven't yet seen. Maybe One or two countries might be the hardest hit at the moment, like South Africa, like Rwanda. We have 75 cases now. But few are reported from, let's say, Ethiopia or Burundi. Perhaps it's now time to focus on the hardest hit countries and maybe support them human resource-wise, equipment resources-wise. And our time will also come. We also need their support. So such inter-country collaboration, support, prioritization, I haven't yet seen. That worries me. But as I said, as far as surgery is concerned, we are already few. And the threat that we will lose some of our colleagues is still there. Resources will be completely depleted. The already existing lack of access to surgery for elective cases is going to double or triple very shortly. And Africa already has people that are really seriously affected by malnutrition, TB, HIV, already compromised. So being young and fit in Africa is not a guarantee that you won't die from the disease. Those are real threats to us.
Yeah, and so some of the clinicians I've spoken with and heard from, there is a lot of fear, particularly around the concern of becoming infected, of being vectors themselves to not just to their patients, but obviously to their families, and certainly the concept of potentially being exposed to very, very high viral loads without the proper equipment. Can you tell me a little bit about what you and perhaps some of your colleagues are feeling with respect to some of the kind of the fears around that?
Yeah, absolutely. PPEs are very important. Unfortunately, African countries have numbered PPEs, very few. You have to change masks every few hours. You have to change your gown every few hours. You need millions and millions of masks and PPEs to prepare for the disease. I'm very sure we don't have that yet. Even the discussion about the usage of masks is not yet settled. What the CDC and the WHO are recommending are kind of opposite. I know the background. I can understand the background. The scientific basis or availability of masks has something to do with it. But the implication here is that we don't have those PPEs. And you just cannot say, I'm not going to treat someone just because I don't have.
I think I've lost you a little bit. Sorry, I just lost that. You said simply that you can't just say I'm not going to treat you because I don't have PPE. So
no, it just doesn't work like that. It doesn't work like that.
So we know those providers are going to be providing care regardless of whether or not they have good PPE.
Absolutely. And the lesson we are learning from China and the US is that it doesn't matter if you are rich or poor. It doesn't matter if you have the money to buy the equipment. The equipment is not there for sale. Everybody wants it. I have seen some innovations in Ethiopia and in Rwanda, engineers trying to develop their own locally, which really should be supported by the government and trying to kind of expand it. But we are really worried. We are worried. Even if you don't have PPEs, you will continue to treat patients. That's what our oath actually means.
And so I recognize that it's soon kids are going to need feeding and all the rest since we're both at home with our kids and our family. Let me try and end a little bit on a positive note. What gives you the most hope around this? And I mean, you mentioned some of the things around maybe there's obviously the potential for an explosion of local innovation around some of the attention that will be paid to the entire surgical ecosystem. What gives you the most hope about what's happening right now?
The fact that we are now united as a world. this has been a common enemy. So everyone is united against the infection. People are understanding the importance of social distancing, even personal distancing. People are understanding the concept of isolation and quarantine and are accepting it. I see lots and lots of African wealthy people donating money, lots and lots, thousands of US dollars, millions of US dollars in each country. I see governments ramping up their support, a big chunk of their annual budget to fight COVID. And countries like Rwanda are showing a real leadership.
Yeah.
This is what you have to do. We are going to enforce it. And we have to save the people. So the fact that we are now being united, understood, and we are learning from the experience of others. Wise people learn from others' mistakes. Fools want to make these mistakes and learn from their own mistakes. So we are learning from China, Italy, the US, and this is a very good. Gives me hope.
Yeah.
Again, as I said, there are many things that actually worry me, but this really satisfies me.
Well, listen, thank you so much for taking the time to talk with us and for letting us video record this interview. As you know, we've known each other for quite a while, and I want to wish you the best and to stay safe with your family. Please, let's keep in touch. One of the things that we're trying to do at Lifebox is provide as much information, especially around some of the innovations that will be really important for the subcontinent and other resource poor settings. And I say resource poor now, and listen, New York City is a resource poor setting right now in the sense that there is a lack of PPE. There are clearly not enough materials to treat the number of patients that are presenting. So we're going to need to come up with some very, very innovative and clever ways of overcoming this and getting through it. And I'm really excited to see some of the innovations that come out of Rwanda, of Ethiopia. And so when you hear of them and there are clever ways of preserving PPE, of using your ventilators to best capacity, of using your human resources, please share them, because we would like to spread that learning as well. So there's, unfortunately, I think there's going to be a lot of very stressed learning right now, but hopefully we come together. And I really want to wish you and your family the best. And I look forward to the next time that we can sit down over a cup of coffee whenever this is all over.
Yeah. Thank you very much, Tom. Thank you very much for reaching out. These are difficult times, unsettling times, but I'm very sure united we will prevail. And we hope, and I'm very confident things will settle down. We'll go back to normal. I know the world is not going to be the same moving on. Things will seriously change. But please give my regards to your family. Keep safe, and let's keep in touch.
Thank you, baby. Listen, you take care. And
thank you very much. Have a great day. Bye.
Bye-bye.